Kara, why don't you go ahead and do our intro and reminders for people?
Yeah. Happy Monday, everyone. So today we will hear from Dr. Elvin Geng, and he will be discussing on-the-go adaptations of implementation approaches and strategies. So first, we're going to start with some news and updates, and then we will move into the presentation. Just so that everyone knows, I'm going to be posting these links that you see in these introduction slides in the chat. So no need to quickly write them down or anything like that. So I've just pasted the paper referenced here in the chat that we will be hearing about. So for our news, updates, and events, we are planning for our 2024 AFT monthly seminar series. So if you know of anyone, or if you would like to present on a paper, a work that you are working on and you would like feedback on, something that you would like to discuss with the group, any recommendations on topics you would like to hear about, please feel free to use our submission form. That way we can keep track of all of the different requests, and we are able to plan our 2024 series. This year we've had a number of presentations that have come in through the submission form. So I would say I highly recommend using it, but also if you feel more comfortable reaching out to us, please send us an email. I will put the email in the chat, and it usually goes directly to me, so there won't be any issues there. Just like Russ had mentioned, we are going to be coming up on the 16th Annual Academy Health D&I Conference. It will be December 10th through the 13th at the Crystal Gateway Marriott in Arlington, Virginia. We have the registration link, but it is a really great conference where a lot of D&I folks come, and it's kind of the conference of the conferences of the year, where we hear a lot about different D&I topics, and we are actually currently curating a list of different adaptation, fidelity, and tailoring related talks and presentations that we will be discussing for our December AFT meeting. So I'm going to use that to lead into the next bullet point. So our next meeting will be December 18th, and this is just so that we can move it around for the D&I conference, since I know a lot of people will probably be traveling that week. And so we will have it on the 18th. Russ is going to be our moderator and discussant, and we will be reviewing that curated list of the different AFT related talks at the D&I conference. This is going to be a very dynamic type of discussion, so we really want to hear from you. We want to hear your thoughts on different presentations you've heard, and if you found something interesting, if something came up for you when you were attending the conference and listening to these talks. And so please let us know if you want to email us. You can, if there's a talk that you know that you are going to be presenting. We're going through the agenda currently, and so we're scouring the agenda for all of the different talks related to it. But if you just want to make sure that we have it on the list, please feel free to send me an email. And I will put the email in the chat, but now I will hand it over to Russ for Dr. Geng's introduction.
Thanks. Kara, keep that up there for, whoops, could you go back one slide for just a second? Then we will get rolling, I promise. But just a couple other comments or elaborations on this for each of the bullet points. For the first one, really want to encourage all of us to think creatively, and we'd like to mix this up and keep it fresh. So it doesn't have to be like a totally completed series of work or a publication on here. It can be certainly a work in progress. If you just want to discuss an issue in the field, it can be an article, doesn't have to be your own if you want to do a journal club. So again, we encourage a variety of formats and things. Second, on the meeting, I'm excited about it, having gone through the agenda myself, and among other things, Dr. Geng, our guest today, is one of the plenary speakers and things. So I encourage you to go check that out too. And the final point is this year I will be at the meeting, but I have a condensed schedule. I'm only going to be there for about half of it. So I hope that can be an open-ended discussion as we go forward, and some other people that are there, particularly later in the meeting, can help facilitate that too. So we will finally get going now. If you could go to the next slide. It's my pleasure to introduce Dr. Geng. Just very brief background so we can get to the fun stuff. Elvin is a MD, MPH, as it says there. He's professor of medicine in Division of Infectious Disease, and maybe more relevant to us, our group here, as you can see, he's the director of the Center for Dissemination and Implementation, the School of Public Health at WashU, a great collaborator with many of the folks that we all know. He's very prolific. A lot of his work focuses on research to optimize the use of evidence-based intervention in public health responses to HIV. He does a lot of work globally, low and middle income countries. In particular, he has a lot of collaborations in Kenya, Zambia, and Uganda, as well as in safety net settings in the US. One other note is that in addition to NIH funding, Elvin's work has been sponsored by the Gates Foundation, and that might be something that would be fun to talk about, since I think that's somewhat novel for many of us on here. And with that, I am then going to pass it over to Elvin.
Thank you. Thanks for that introduction. Again, it's a real pleasure to be here. Judging from the group that you've assembled here, Russ, this is definitely a meeting that I have retrospective FOMO about missing out on, but we'll hopefully have opportunities to join in and listen into various discussions. So let me see how to get the screen share started. So yeah, so I think was gonna just perhaps spend a little bit of time today talking to folks about this review paper, and very much welcome, on the go discussion, as many of these ideas are sort of wide-ranging, flexible, somewhat slippery, and but nevertheless extremely interesting. And so looking forward to having some of these ideas that we sort of provisionally put forth here interrogated and discussed.
Elvin, if I can interrupt just a second, if it's easy for you to do a different view, that might help. We can't read the small print I'm anticipating. There you go. That's perfect. Thanks much.
Thanks. Okay, so this is a review that we called on the go adaptations, and so I will start with maybe a little bit of background about it. Originally I had planned to write this review with a colleague of mine who's a statistician, and we were going to discuss two aspects of adaptation that are oftentimes, I think, sort of not always separated, which is the notion of adaptive interventions or adaptive strategies in the sort of quantitative methodologic literature, dynamic treatment regimes, and then adaptive trials, which are trials which change over the course of the trial. And she wasn't able to pitch in the end due to competing demands. So we focused on the sort of first half of this, and we focused on the conceptual aspects of it because I think there's a lot of meat there. But we focused on sort of the idea of adaptations or strategies or bundles of strategies that necessarily change over time. And so I think one of the first premises here is that strategies probably do, for the most part, not, I think, invariably, but for the most part, do require some kind of change over time. And that's because the units of behavior change, whether they're people, providers, organizations, in some universe of interest, have both distinctive as well as shared features, which means that sometimes they'll respond similarly and sometimes they'll respond differently. And I think one of the cruxes of this here is that you can't know upfront, no matter how well you're prepared, who will respond to what. And that implies that you'll have to change as you go, depending on what happens. I think that last premise here is not, necessarily the invariant for all complex interventions. I think in the biological world, I don't know if this is actually going to pan out, but some of the promise of sort of personalized medicine at the level of the individual is that they will be able to figure out who is going to respond to what with a great amount of precision upfront. But I think for the most part, whether it's clinical medicine or implementation strategies, the rule is still that we can't always know exactly what's going to happen, and so we're going to have to change as we go. So I think of maybe the formalization of some of the work around adaptation, particularly in implementation research, as sort of a way of maybe listening to practice, and it's practice adjacent. It's a sort of a scientific framework that is alive to what kinds of situations, decisions, and realities occur in practice. And I think that in practice, this isn't fully formalized, but I think as whether it's nursing or social work, or whether you're a practice facilitator or a physician, the general tempo or the cadence of practice is that you do something, you see what happens, and then depending on what happens, you try something else, or you perhaps don't try something else, or you base what you do on how people or units respond. And that's just sort of a ubiquitous feature of practice. And I would say that it could even be considered the nature of practice, although would love to see what folks think of that. And I think that before I was familiar with formal approaches to adaptation or thinking about adaptation as a scientific thing, I came across many of these things in sort of practice. And I still, now that I'm more familiar with thinking of adaptation as a formal thing, see this reflected sort of constantly in practice. And I'll give you many examples that I think are very consequential, just to throw out a couple to sort of keep it connected to practice. I'm an infectious disease doc, and in most of my career, I've done outpatient HIV medicine, and many people present to clinic for treatment with both a mental health, untreated mental health issues, and untreated HIV. And so there are different providers, and different organizations really have different dispositions or local customs about how to handle this situation. So in many cases, people will, this has changed over time, but sometimes people will try to treat the mental health issue first, wait for some response, and then treat the HIV. And the rationale was, if you don't treat the mental health issue, the treatment for HIV is not going to be that successful anyway. So you should start that way. On the other hand, many providers do the opposite, right? So they say, well, look, we don't know how they're going to respond to the mental health treatment. The HIV, there are clinical consequences to waiting, so we treat that first. And once we have that somewhat under control, then we treat the mental health, we intensify. with treatment of mental health. And that sequence of treat this, look for response, then treat that, or treat that, look for response, and then treat this are patterns in practice that are adaptive, but they are different adaptive strategies, and no one knows if like the first one is better or the second one, and generally they're not thought of as frankly as science, right? I think like if you talk to people, there are myriad such practices, and they're considered sort of like the art of medicine or something like that. But with tools about adaptations, or sort of what we're calling on-the-go adaptations in hand, and the sort of methodologic sort of frameworks that accompany it, we can begin to unpack these things as scientific issues and examine them systematically. And I think, you know, there are various methods for doing that, various designs for doing that. I won't spend much time talking about those today, but you know, some are more complicated than others. But I think the core conceptual basis of these things is there are different ways of thinking about do this, see what happens, then do that. You know, I have a couple of non-clinical examples here, knowledge brokering, for example, but I think most people will recognize this kind of structure as being visible in many situations that we're interested in. So I think if we think about this practice-based tempo as something with an underlying anatomy to it that we can study, there are many scientific questions that, apart from just comparing one way of adapting as we go to another, you know, we can ask questions about are changes that are responsive to initial effects sort of categorically different from changes that do not, right? Like, in other words, are scheduled changes the same class of things as things that change based on response? Can changes, even when they respond to initial effects, also create harm, that create harms, you know, also be considered adaptations? Or should we think about concepts such as maladaptation? One of the things that I found interesting when I started reading a little bit more about adaptations was that, you know, the field in which adaptations have been dealt with most extensively is in evolutionary biology, which is you know, it's half of the whole conceptual basis of the field. And there are many theories and micro theories about adaptation and maladaptation in the field of biology that we might benefit from in implementation research. What about strategies that occur which both improve implementation and reduce effectiveness? Now, is that possible? Maybe different strategies end up reaching different user segments in different stages, and those different user segments have different responses. That's something worth considering, given the complexities of implementing at a number of different sort of units of interest. And then how can we avoid implementation efforts that inadvertently prioritize target populations with the most resources and the greatest existing engagement? And this issue comes up, I think, it's been called, there's been many names for it, the inverse need law. There are other names for this, but generally this is a pattern that we see across many instances of health services and public health that we don't like, but have a trouble avoiding. And then do certain adaptations create unintended future harms or constrain future choices? And this is another sort of interesting aspect of sort of change as we go, where we think about the immediate effects of what we're doing, but there may or may not be additional downstream effects that are either created or enabled or constrained by the choices that are made now. And even though this theory of behavior is sort of, I think, a little bit old-fashioned now, sometimes there economists have thought about healthcare worker behavior as being composed of sort of intrinsic motivation and extrinsic motivation, and are methods that work through one mechanism potentially going to constrain strategies that work through another mechanism later on. Specifically, does extrinsic motivation crowd out intrinsic motivation? These are all sort of questions about adaptations that could be of interest to us. Okay, so I think the crux of the review is this diagram, and I'm going to spend a little time on it. I'm also going to scan the chats to see if there's anything that anybody wants to throw out at the moment.
Not yet, Elvin. I'll help you monitor it, but
okay.
let's love to look into the diagram here.
Okay, so this is a diagram based loosely on what I think people call a directed acyclic graph, which is used in many fields, epidemiology. It's very popular in epidemiology at the moment, but it's used, I think, in many disciplines. But in this kind of schema, it's a diagram composed of several very simple pieces or constructs, which are ideas or variables represented by words, and then arrows which represent cause and effect. And that's really it. It's very flexible. But the people who are proponents of this kind of diagramming point out a couple of things about the strengths of just these very simple ideas being rendered as a diagram. So causes and effects in statistical notation can't be represented because statistical notation represents associations, and causality is sort of eludes the semiotics of statistics. And so these diagrams are thought to be in part maybe a solution for that. And then secondly, once constructed, these diagrams have implications for what these variables mean in analyses and what they imply about each other. So just very briefly, if you use one of these diagrams, if two arrows point into one thing, it implies that there's an effect on the effect. So 2 and 5 both point into C, which means that which implies that the effect of A on C is affected itself by the effect of B on C. And then these diagrams also represent sort of concepts that used to be elusive in epidemiology, I think, but which are simplified and clarified by these diagrams. So, I don't know how many people learned epidemiology in the era that I did, but the definition of, say, confounding involved several phrases that had to do with, exposure associated with the confounder, and the confounder is associated with the outcome, but it's not a mediator. But in DAG world, the confounder is a common cause of an exposure and an outcome. And all of selection bias is conditioning on a common effect. And that sort of cuts to the chase about what those concepts are. And it avoids sort of unnecessary elaboration of those, I think, ideas. But nevertheless, one thing that we have been very interested in about these diagrams is as a way of rendering a provisional working theory about how a concept works, or what a concept is composed of. So Judea Pearl, who writes a lot about causality, says that we think of Y as being two things, like humans think about Y as being two things, like an explanation. So Y is how, if you give X, like Y happens, that's one type of Y. But the other type of Y is the mechanism of how Y happens. So how things happen, we also interpret as as why and as an explanation. And so in some ways, using diagrams like this to decompose complex ideas into their components is a way of providing an explanation for them. The last thing I'll say about this before I dive into the details is that once these diagrams are constructed, they give rise to relatively easy ways of sort of testing the integrity of what you've created, because they have implications for statistical analyses. And I won't get into that, but they help people decide how to analyze things, and then the analysis can be shown to be consistent or inconsistent with the underlying structures. But at any rate, this is how we started thinking a little bit about what on-the-go adaptations were composed of. And I think in this diagram, we're saying, in a strategy, you take some action, and I'm using the word approach, strategy, or activities kind of intentionally broadly. There is some kind of an effect. So it has an effect, A has an effect on B. And then here, importantly, B has an effect on C. So the initial response of whatever you're interested in has an effect on shaping subsequent approaches, action, or activities. And then that has an effect on the distal outcome that you're interested in. So what we said about this diagram is an on-the-go adaptation has to have 1, 2, and 3. It can't be composed of just one of those segments. For example, if you just look at the effect of C on D, that is the effect of an adapted thing on some distal outcome, but it doesn't capture the entirety or the whole concept of adaptation, which has to start from somewhere, see where you go, and then do something based on that, and then see where you end up. The diagram also has 4, 5, and 6, which are not requisite, at least in our sort of provisional way of thinking about it, for an on-the-go adaptation. But they often accompany and interact with the on-the-go adaptation. So, if you look at 4, for example, many times the initial outcome has an effect on the subsequent outcome, irrespective of any change in action. So sometimes things are a done deal halfway through, right? And so there is an effect of B on D that does not pass through C, and those need to be accounted for and examined. But in and of it, that step in and of itself is not requisite for an on-the-go adaptation. And then, of course, A can have a direct effect on D. Sometimes the initial actions have an effect on the final outcome that isn't necessarily mediated by what happens in between, because it's sort of a done deal from the onset. And then A on C is the actions of an adaptive approach on the subsequent action. This is a little bit related to what we talked about, how initial actions can constrain or enable subsequent ones, because perhaps the universe is not available once you've started a course of action. So this attempts to capture what we thought were the sort of conceptual components of an on-the-go adaptation. And I think we use this diagram to structure some of the subsequent discussion of what this conceptually means and how to study it scientifically. So maybe let me stop there. I think having said this in a few sentences, Russ, it does strike me as maybe containing a lot, and I have questions for myself, so I imagine people have questions for me.
We do have a couple things in there, and thanks so much. And yeah, I think this is a great slide to keep up here. There's so much in here, and I think the implications are really important for the field. So we've got a couple of comments, and I think we can just go ahead. The group isn't that large, and just ask people to unmute when I call you out, if that's okay. But Greg has a question here related to some of the other work that's going on in terms of looking at and evaluating implementation mechanisms. But Greg, why don't I let you go ahead?
Okay, so hi, Elvin. Thanks for this. Yeah, so just as you were talking, I was thinking about the work by Carol Lewis and colleagues on, identifying, being clear about mechanisms, identifying them, diagramming, assessing, and testing mechanisms. And I think at the outset of a project, you can do that, but those may change over the course of the project. And I just wondered about your reflections on, coming in with those theories, being proactive and thinking about what adaptations may occur. So planned versus ad hoc adaptations.
Yeah. So I think so Greg, I've been quite interested in the conversation about mechanisms. I think that many of the ways that we've categorized things that we do in implementation strategies, in and of themselves and with other strategies, sort of occur in a causal web, oftentimes with each other, and understanding how those things work together in concert in that way is helpful for a number of reasons. One is that in my mind, and this is perhaps an underemphasized aspect of it, is that it gives us a route for generalizing when generalizing the nominal sort of endpoint effect is not possible, because it decomposes an overall effect into pieces, and then we can ask ourselves, like, which pieces might apply where and which pieces might be affected by what where. So I think that the mechanistic conversation is really important for understanding what different sort of complex strategies sort of really are. And I think that, in our own work, in my own applied work, we oftentimes come up with a theory of how, a multi-level strategy works in a particular context, and then we revise that, as we go, a little bit in the style of Mary Dixon Woods's paper, sort of, I think it's called Explaining Matching Michigan, where she looks at kind of how this preventing catheter-related infections was thought of at the onset, and then she looks back at the whole thing and says, what was the kind of like a post hoc theory of change, using qualitative methods. So I think that's number one, extremely important. And then I also think that, like, in general in the field, the way that we think things work is a moving target, just like the effects that things have is a moving target, right? And so part of the job of evidence synthesis, I think, is to try to continuously update how we think things work, using sort of a broad swath of literature. But here in this particular paper, I think maybe went out on a limb a little bit to try to apply that mechanistic lens to a concept rather than to a strategy. There's maybe ways in which it works here, in helping explicate it, and maybe which it doesn't. But I think, some of my background is in epidemiology, and I found this sort of intersection between the mechanisms conversation in implementation science and concepts such as, like, transportability, from sort of, Judea-Pearl and to be interesting. And Greg, I'll say one more thing about that before I stop my sort of meandering comments, which is that, when I got interested in mechanisms, I sort of realized that mechanisms is actually like a large topic in the philosophy of science, where people have, many of you may know more about this than I do, but sort of explicating what a mechanism is in science, across, talking about, like, lab science and everything else, it turns out to be what philosophers think is a major sort of thread of scientific thought, over many decades. So anyway, I'm not sure that at all spoke to the question, but I'm happy to take another shot later.
That's great.
Sure, thanks.
Thank you both. I think in the interest of time, unfortunately, I need to kind of be time cop here and move it along too. Let me
Yep, sorry.
turn it over. No, that's fine. This is great. I wish we had, an hour to go into this as well as other things. But why don't we take one other comment here? Maria Fernandez does have one about talking about the intervention and the implementation strategies, their relation. I'll open it up to Maria in just a second. But as we do, I just want to call back. Elvin's mentioned a couple times Judea Pearl work. And I just like to cite, this is some of the classic work to kind of start an introduction that I think is somewhat, at least for people like me that aren't that sophisticated, to try and understand some of these concepts and models of causal thinking and things. So I just really would recommend you to that as a source too. But let me turn it over, if we can, a brief comment and a brief response so we can get to the rest of what Elvin has to share with us today. So Maria?
Yeah, thank you. Hi, everybody. As usual, very thoughtful and provocative comments so far, Elvin. So thank you. Just wanted to make one really quick comment about the mechanism conversation. I think that the question about mechanisms and understanding, or at least, having hypothesized mechanisms is really important to even be able to characterize what A is, right? So what the initial actions are, and where on-the-go adaptations are happening within that causal path. My question, though, Elvin, has to do with the intervention itself. And a lot of times we're sort of trying to do multiple things at once, including adaptations of the intervention itself and adaptations of the implementation strategy. And in fact, sometimes you have to make an implementation strategy change because a component of the intervention has changed. And so I'm just wondering how you see this diagram maybe being the same or different when there are adaptations to the intervention itself.
So I think that's a great question. I mean, part of the reason why this particular kind of review was focused on strategies was to sidestep that question. Because in many ways, so I'll give you. I've been actually meaning to, Maria, that have this conversation with you at the two last high IRIs, which spans 2 years now, because it's the kind of, I think an interesting question to discuss. So on the one hand, I think that the notion of sort of separating interventions from strategies is critical, right? Because it brings our attention to a set of things that we put in a distinct place in the field of implementation science that is absolutely central to our thinking. On the other hand, if we think about any particular sort of theory of change, if you will, or mechanism of change that involves any span of causal effects that you're interested in, which could be broad or narrow, depending on what you're interested in, the insights about their relationship that a mechanistic approach gives us, I think, offers us insights that that classifying those things off the bat sometimes don't. I guess one thing that I sometimes say is that causality precedes categorization, and that what things mean depend on where we put them in this causal chain. And so I think that with some of those things you talked about, so what do you think, how do you think about a strategy and how a strategy adapts in the presence of an intervention that does or does not itself need to change? is an interesting question. And I think we could like collectively try to explore and exploit that using like a diagrammatic approach. I think that could be quite interesting.
Thank you. Why don't we go ahead, Elvin? I'll just underscore one thing that throughout this that I'm hearing, and I think Elvin just alluded to, and that's the nature of, if you will, conditional or sequential effects. And I think that's really shown well here in the diagram to think about that. To me, that advances the discussion beyond what we usually have to think about that notion of sequential factors. I think can advance our discussion as opposed to just a more static or thinking about initially doing one type of adaptation. So I'll let you return to what you have for us here, Elvin.
Yeah, thanks, Russ. And I'll just say one quick thing about that. We in this particular paper, we also did focus on sort of adaptation, sort of as you go, right? So as during practice, and there was a debate at the beginning about sort of what about changes that you make based on sort of static things, things that don't change. And I think that in some ways, like structurally, they could be similar, but in practice, I think they do turn out to be at least somewhat distinctive phenomena that, you know, may or may not, that may be something worth thinking about. Okay, so I guess I would just, since time is short, say a couple of other things about connecting this kind of mechanistic explication to some of our ideas in implementation science. So many constructs, I think latently or not so latently, contain some of these notions about sequencing and about adaptation. So, you know, normalization process theory posits these phases, coherence, cognitive participation, collective action, reflexive monitoring. They're not posed necessarily as sort of a causal chain, but they imply some kind of temporality and causality, right? Because obviously you're not going to do reflexive monitoring if there's no coherence, cognitive participation, and collective action first, et cetera. And I think, you know, Wenzing's approach here also contains an implied set of effects which are sequenced, which can be then maybe analyzed or examined through constructs such as on-the-go adaptations that we just looked at. Okay, so if we think about on-the-go adaptations as sort of doing something, seeing what happens, and then doing something else, I think there are classes of those kinds of questions that have broad applicability or broad utility in implementation research. And these are just a few that I've put up there, and in the paper we talk about some of these. We are often interested in ways of intensifying. So if you were to offer any particular, say, approach, be it a training or audit and feedback or something else, it may be of interest how to intensify. You certainly don't want to start with too many doses because people will get annoyed and it will cost a lot of money. But if you start with one dose, that may not be enough for everyone. So where do you start? How long do you wait for a response? And then what do you escalate to? Is it a question of empiric interest across, I think, many implementation strategies? How to sequence and how to assemble sequentially different aspects or different strategies that have different mechanisms. We talked a little bit earlier about, you know, intrinsic and intrinsic motivation, perhaps for healthcare workers. You could imagine pairing a pay for performance approach to some kind of practice change with a training and sort of social learning approach. But what mechanisms should be called upon when and how they should be sequenced could also be something that represents kind of a broad class of questions in on-the-go adaptations. There's many questions about duration. So how long do you do something? Should you do something and then go switch right away? Should you do something and give more time for a response? I think those are also an interesting class of questions. And then, one that I've come to gravitate towards more recently is thinking about comparing escalation and de-escalation strategies. So basically, in clinical medicine, we do this sometimes. There are things where you start strong and then back off once there's a response. And then there's things that you titrate up. So antidepressants, you start at a low dose and then you go up, and you wait and see if there's side effects and you keep going up. For those of you who do inpatient medicine, heparin is the opposite. You go all the way it's a treatment for a blood clot. You go all the way to the top, and then you cut back slowly. And I remember as a trainee that many junior doctors didn't understand that and didn't understand why the dosing always pushed people to the top and then you backed off. And so they would do ad hoc dosing where they started lower, but the whole point was to push the dose and then back off. But that also exists for a myriad of sort of implementation strategies, when and how to intensify or de-intensify. This is just I want to just show one or two quick slides about an applied study. This is sort of doesn't necessarily fall into the realm of implementation research, but we many years ago did quite a number of studies looking at sort of patient-reported reasons for not coming back to clinic after starting HIV treatment. And on the right here is basically a tabulation of patient-reported reasons in many patients across a number of countries. And you can see obviously that there are some things that are quite common, but there are many, many things that contribute, right? And so one of the studies that we designed in response to this, the fact that barriers are heterogeneous and they're not necessarily always completely predictable by observable sociodemographic characteristics, was a sequential multiple assignment randomized trial, which is one way to examine and compare various adaptations. I won't get into the details of that, but suffice it to say that I think we found a few interesting things about the nature of how interventions should be sequenced, and in particular when bringing in sort of their cost, the optimal sequence, was not the one that went from sort of least to most intense, and was definitely but it was something that started with a little bit and then went up if folks didn't do well. We also learned something quite interesting about conditional cash transfers, which I won't get into, but basically some things you can't stop. They have side effects when you stop. This is an example from the paper just about different ways of thinking about escalation and de-escalation. But why don't I, since time is short, just bring it to an end here, and maybe open up for a little bit of discussion, which I would be very interested to hear what people think.
Great, Elvin. Thanks. Let me just mention as I transition here, I'm going to call on Amir, who has some thoughts or questions about adaptations, on-the-go adaptations and implications for scale and scale up and spread. But I just wanted to point out so much of this, Elvin just talked a bit, has, I think, important implications for cost, time and burden. And as we all know, cost is one of the key, certainly not the only one, but one of the key determinants of sustainment. So I really like thinking about the implementations and where we can save cost and where maybe it's a bad idea to try and save cost. And as I'll ask Amir to unmute himself here in a second, but if there's a chance, Elvin, and I know it's maybe an impossible task, but as you answer Amir's specific question, if you might share with the group some of your thoughts and synopsis of your work on transportability. I find that something that's refreshing and a little different than the way we often think about it, at least in terms of US-based work. So that'd be great. But Amir, why don't you go ahead?
Thank you, Dr. Glasgow, for the opportunity. Thank you, Dr. Geng, for the very informative presentation. My question is mostly about QI projects and initiatives. So usually in QI world, the intention is to standardize care and be rigid and kind of doing these PDSA cycles. But in terms of flexibility, at the beginning of QI projects, you need to develop your measurement plan, your implementation plan, and usually adaptability. I'm not saying 100%, but based on my limited experience, there's very little space for flexibility and adaptability. So I wanted to have your insights and thoughts about in the QI world, how much adaptability is accepted or is good, having your insights about that. Thank you.
Yeah, I mean, I think very briefly, I think of like maybe the sort of cycle of work in QI as very much fitting this on-the-go adaptation kind of approach, right? Because you do like PDSA cycles, you do something and then you see if it works, and then maybe you decide to scrap it because it didn't plan out the way you wanted, and so you go back and you try something else, maybe with a different mechanism, or maybe you didn't do enough of a dose to begin with, and you try again with a larger dose. But that cycle where you do something, and then you see what happens and you respond, to me fits very much into this kind of like maybe structure. And of course, what you do and how well you do it is another question, but it is maybe across cycles, maybe within cycles, the way sometimes it's carried out, maybe there's less flexibility. But yeah.
No, thank you. Sorry.
Super. Time is getting short. This is so rich. We can do it here. But why don't I let Julia jump in here? It'll probably be time for our last question, then I'll just make a final comment or two.
Awesome. Thanks, Russ. Thanks, Elvin. This was fabulous. So I work primarily with implementation support practitioners and people who are like on the ground implementing and scaling. And I think that the need to figure out how to do on the go adaptations to the strategies is like top, like literally, if you can't show up with that right now, people are saying goodbye. I won't even talk to you. And I think the question I have is, people keep asking, how do I know what the core components are of those change strategies? And it feels like, or the implementation strategies, and it feels like the field of implementation science isn't there yet. And so I was super excited when I read this a few weeks ago. We've been leaning towards more of a functions rather than core components based approach, which is closer to the mechanisms, but maybe feels more accessible to practitioners. Do you get a sense that the field is going to be close to having answers for people like that, about like which things they can adapt and which things they can't, in the somewhat near future?
So great question. Would love if I had more time to ponder it a little bit more deeply. But I think that we will make like incremental progress. I think that using kind of like a mechanistic approach, what one might ask sort of what components are core under what circumstances, and under what circumstances what other things are core, right? And to me, with a combination of maybe bringing some of the implicit practice-based approaches into some sort of structured scientific examination, and then also continuously revisiting the ways in which we sort of lose things when we structure complex emergent practice into sort of scientific frameworks will help us make maybe incremental progress. But I'd love to talk through, if we had more time, with you a couple of specific examples, because I feel like we could delve into some of those details. Russ, do you want me to say 1 minute on transportability? Because I do think it's an important concept.
Yes, I would like you to. And I'll just say, to save the time, just thank you so much for doing this. It's been a really rich discussion. I hope maybe some of you can continue this discussion at the either offline or at the meeting, but I just really want to thank you for this. And if you haven't had a chance, I really encourage you to take a deep dive into this paper by Elvin and colleagues. It's going to be really influential. But please do take us home with a comment or two about transportability.
Thanks. You know, I think if you look in the published literature about transportability, a lot of it is focused on kind of quantitative stuff and estimation. But to me, the most important aspect of it is the conceptual, the way it conceptualizes learning in one setting and inferring in another. And I think most traditionally we thought, okay, well, we'll learn in one setting. If we get an answer of like 2, that like if the study is done well and externally valid, then there will be 2 in other places. But in truth, it's not. Even if you got rid of all study artifact, if the answer is 2 here, it might be 4 here, 6 here, and 8 there. And so what transportability does, at least in my read of it, is that it says that if you understand the mechanism of how it works in your home in the source setting, and that enables you to identify the contextual factors that will affect the different steps. And then you have to ask yourself, what do I know about the contextual factors in my target setting? And with that information, combining information from your target setting with information about how your sort of thing works, you can make principled inferences about whether or not the thing is going to work and how it will work in your target setting. So I think of it a little bit as seed and soil. Traditionally, we're focused on the seed, but in truth, if you want to know if the seed is going to grow there, you got to know what's in the soil over there. It's not enough to know what the seed is, right? And so sort of transportability, I think, is a framework that helps us combine what I think traditionally has been thought of as disparate types of information into one sort of roadmap for generalizing.
Thank you so much. And I think I totally agree with Katie. I was going to say the same thing. The soil and seed analogy is a great accessible way to talk about some of the contextual factors involved in our field. So thank you all. Hope to see you at the meeting and on our meeting next month here. Take care.